you. All right, let's let people in, and I'll let you welcome people, Ariana.
Sounds good. Hello, everybody. Welcome. Put your microphones on mute so that we can have our presenters spotlighted. There'll be opportunity for discussion and question and answer at the end. But welcome and thank you for joining.
Yeah, still a handful of people that are connecting their audio, so we'll give the folks a minute here.
Sounds good.
Yeah. And people still coming in. Let's see here. Yeah, I think we're good, Ariana.
Okay, awesome. Welcome, everybody, and thank you for joining us for our learning session today. I'm very excited to introduce our first speaker. We are still having some people join, so we'll take just a minute. What this will be today is a learning session. I see a lot of different types of people represented in the gallery today. We have recovery support professionals, of course, but we also have employers. We have workforce development professionals. We have government officials. So feel free if you want to drop your name and your email in the chat. What brought you here today and maybe what sector you represent, so we have an idea of who's come to the table to learn today with us. And as I mentioned, I'm so excited to introduce one of our speakers today, Ana Maria Hernandez. She is a recovery-friendly ambassador, workplace ambassador for the state of Nevada's recovery-friendly workplace initiative. I'll let her give some more information as she joins us here, but their state-run initiative is run through Foundation for Recovery, which is an accredited recovery community organization. And so I will let Ana Maria, if you are ready, take over and get started to explain a little bit more about their state-run initiative, how it formed and what they're doing. And then we'll transition into my work. I'm Ariana Williamson, the advisor for Recovery Friendly NC, and how Wilkes County, North Carolina got started with our own recovery friendly workplace initiative and how we plan to support others in moving this work across the state. So thank you, Ana Maria.
Hello, thank you everybody, and thank you very much for having me here today. My name is Ana Maria Hernandez, and I am a Nevada Recovery Friendly Workplace Ambassador. And today I'm going to be talking to you a little bit about our initiative and how everything has gone here in Nevada so far. So I am going to switch screens very quickly, so please bear with me.
Recording in progress.
Really quickly, Ana Maria, let me explain too, the executive director for Foundation for Recovery was going to join us today, but he is unfortunately ill, and Ana Maria is an excellent stand-in. She is the boots on the ground working directly with employers on their initiative and will be able to give us a really robust rundown. So again, thank you, Ana Maria.
Thank you. All right, let me now. Oh, I am not able to share my screen.
Yeah, give me a second, Maria. I'll help you out. Give me 1 second.
While we're doing that, welcome again to those who have just joined us. And please, if you're comfortable, put your name. You can put your email. Definitely put what kind of sector you're joining us from, whether you're a recovery support professional, an employer, etc. And here we go to get started.
Thank you. And thank you again, everybody, for your patience and for working through it with me. So welcome to the Nevada Recovery Friendly Workplace Initiative. We are very, very proud of our initiative here in our state. because we are very proud of helping workplaces become part of the solution and be that place where we challenge stigma and help build stronger, healthier families. So the recovery-friendly workplace, it started around with our former governor, right? And it is championed by the Nevada Department of Health and Human Services. We officially launched it on Recovery Advocacy Day in 2021, which was a really cool day where all of the legislators and our governor and elected officials all got together and declared that in the state of Nevada, in our capital, that was Recovery Advocacy Day. And elected officials and members alike all came together, and it was a really cool event where we were able to launch this initiative that, like Ariana mentioned before, is promoted by Foundation for Recovery.
Really quickly, if everybody could mute your microphones so that we can hear the presenters. Thank you.
Thank you. The purpose of our initiative is really to help employers be equipped with the tools and resources necessary to respond when one of their employees may be struggling with substance use, or one of their family members may be struggling with substance use or mental health challenges. We really want to challenge that stigma that comes with addiction, and we want to help build healthier workplaces where people can thrive in their recovery and don't have to hide in the shadows about their recovery status. This is really important because about 75% of individuals who use substances are employed, which makes sense, right? We all need our livelihood. We all need to pay our rent. So the majority of individuals who are struggling with substance use or mental health challenges are employed. So the workplace then becomes a really low barrier way for people to access resources, right? We all go to our jobs on a daily basis. So if we can get the resources we need to find recovery there, how beautiful is that? Not just that, substance use disorder also costs states a lot of money. In Nevada alone, about $6.8 billion. And the majority of those costs are incurred by businesses in the form of employee turnover, loss of productivity, increased accidents, increased insurance costs. But also it really affects the people that work in the business, right? How present are you really whenever you're hungover or whenever you are using a substance, right? So fatigue, tardiness, not showing up to work, not calling to say that you're not showing up to work, greater risk of accidents or incidents, right? Problems between coworkers. We have all had that one coworker that is not pulling their weight in the team. And because of that, we don't like that person very much, right? So then bad vibes grow in the workplace. Right now on the screen, we see a list of the occupations most impacted by substance use disorder. And in Nevada, we have a bit of a problem because Las Vegas is the entertainment capital of the world. And the restaurant and hospitality industry is the profession that is the most impacted by substance use disorder. Our second biggest industry in Nevada is construction, which is also on this list. And also very surprising professions on the list, police officers and firefighters. Literally the people that are meant to come and help us whenever we are having a crisis are actually going through the exact same struggles that they're responding to. So we need to put resources in place so that they are able to, first of all, help themselves so that they can help us better. Other surprises on the list, doctors and healthcare professionals. Right? High stress jobs and very demanding shift work all contribute to substance use disorder in the workplace. Here in the state of Nevada, our Recovery Friendly Workplace initiative has a couple of different parts, right? So the Recovery Friendly Workplace ambassadors at Foundation for Recovery, so Samantha Steele and myself, we do the Recovery Friendly Workplace Business Organization designation. So really what we do is going to businesses, do a training with the business about the science of addiction, Recovery 101, the laws and regulations that protect employers and employees whenever it comes to substance use disorder, as well as the recovery resources available to the people. And we train organizations and we equip them with Narcan, fentanyl test strips, and the resources available so that they can put them in their workplaces so that whenever one of their employees has a need for any of these resources, they know that they can easily access them. On the other hand, we also partner with the state in a very exciting partnership for the state to help us with workforce placement. So this is a very new partnership between Foundation for Recovery and the Department of Welfare and the Division of Welfare and Supportive Services, where we are placing people in recovery back into the workforce. So while Samantha and I are building relationships with businesses that are willing to employ people in recovery, people that are going through the welfare system in the state of Nevada also have access to the Recovery Friendly Workplace Initiative, where they receive workplace training, workforce readiness, all types of workforce etiquette courses, so that then they are well equipped to go back and re-enter the workforce, hopefully in a job that they like, right? And in a job where they can build and in a job where they can progress, and not just the job of the moment, right? But we want to equip them with the trainings and education necessary so that they can thrive in their recovery in their new workplace. So the state of Nevada is doing an amazing job at helping us with all of these trainings and in placing people in recovery back to work. We have a job board where recovery friendly workplace organizations can post jobs and people can apply to them. We have eligibility specialists that are placed throughout different recovery organizations in the state, where a state worker is actually helping our community sign up for benefits that are available through the state, whether that be SNAP benefits, TANF, if they need housing, they help them enroll back in vocational training and in school. So it's really amazing. And then our third component is our hospitality training. So one of the things that we're also doing is that we have employed the partnership of an organization that teaches people how to work in the hospitality industry, since it is Nevada's biggest industry, and host job fairs right after the training where people can be hired on the spot. Right. So through Foundation for Recovery, we provide all of the recovery resources for individuals. The state helps in employing those individuals. And then we have another path for people to enter the biggest industry in Nevada that pays well and supports families and also has access to unions and a lot of benefits. So those are the three biggest components of our initiative that we're very proud of. And the reason why we do this is because our jobs and our employment really does play such a huge role in giving us purpose and giving us structure, right? Which are all crucial for our recovery goals. I'm sorry, did somebody have a question?
No, I think somebody was accidentally off of mute. We just muted him. Go ahead.
Thank you. So we are very happy because we have noticed that our initiative not only helps people in recovery, but also their family members and loved ones, and really anybody in the workplaces that may be struggling with any type of difficulty at all, right? Recovery is a process of change through which people improve their health and wellness, live self-directed lives, and strive to reach their full potential. And personally, I absolutely love this definition because it does not mention mental health or substance use at all, right? It means that we are all in recovery from something. I have not met the first person that has crossed through this earth unscathed, right? So we all have something that we're in recovery from, whether it be trauma, a loss, or just any type of difficulty, right? So the program really aims to help every single employee in the workplace, not just people that are struggling with substance use or the people that love them. So Ariana, we have this little video. You let me know if we have enough time for it. It's about like 1 minute and 30 seconds long about why we hire people in recovery, why we like to.
I think that's totally fine if you want to play it.
Perfect.
But I decided that I wanted to take my life experience and the way that I had been impacted by addiction, and I decided to go into the field of alcohol and drug counseling. Now, I had the best of intentions, but I was bitter and I was hurt at the time, and I did have this expectation of what I would see when I got into the treatment environment. And based on the stereotype and stigma of addiction, you might be able to guess what you'd expect to see there too. Bad behavior, criminal histories, broken families. And yes, those elements were a part of someone's story at times. But more often than not, what I saw was people who were struggling immensely. And despite that struggle, there was something unique about them, something amazing. I came to believe that there wasn't a problem that they couldn't solve or a bind they couldn't get themselves out of. And it was incredible to watch because as someone's recovery came more and more to the forefront of their life, the values of recovery started to come out more and more. Values like honesty, integrity, gratitude, and hard work. And it was truly this incredible transformation from addiction to recovery. And the more I got to witness those incredible stories, I realized that it was such a shame that just because someone had the label of being addicted, that their potential was put into question.
Thank you. And I absolutely love this video because it really speaks to my own experience working with people in recovery. Nobody's more accountable, nobody is more grateful, nobody puts in more motivation and work, right? Because we are all grateful for the second chance. And we have seen that again and again and again through our initiative. The purpose of our initiative really is to challenge stigma and help people bring those recovery values to the forefront of their life in their workplace. Every time we go and we speak to a new business, all of the employees are always really glad that we're there. Everyone opens up and shares their stories. And for a lot of them, is the very first time that they have ever been able to express some of these challenges at work. And they're really grateful for it. They're grateful for the knowledge and they're grateful to be heard and be seen, right? So that is the purpose of our initiative. We have incredible success stories already. At the moment, we have 9 designated businesses, and this month we're designating 11 more, which is really, really amazing. Because of the initiative, we have had several people enter inpatient treatment. We have also had people enter IOPs, people that kind of started the process of contemplation if maybe they were having a struggle. And we have also had tons of family members that have been helped, right? That have either joined a craft group or a family group, or that have just kind of like started that journey of realizing like what the source of their struggle is in their family, right? And we have passed out hundreds and hundreds of Narcan kits and hundreds of fentanyl test strips, not just to people who regularly use, but also to recreational users, right? People that recognize that fentanyl is deadly, right? And want to protect themselves and want to protect others. So we're very happy and very proud of our initiative. We are looking forward to our next year and all the huge businesses to come. So thank you very much, everybody, for giving us the space to share with you today. If you have any questions or anything, please feel free to ask, and thank you for having me.
Awesome. Thank you so much, Anna Maria. And what we'll do is we'll move right into my presentation. And if you have any questions for Anna Maria, feel free to put them in the chat or save them. We're going to have about 20 minutes at the end of my presentation to get some Q&A and discussion going. So let me switch to my screen now and explain how we as Wilkes County, North Carolina, brought the work that Nevada and states like New Hampshire, Rhode Island, Pennsylvania are doing into our small community. So first of all, my name is Ariana Williamson. I am the advisor for Recovery Friendly NC. I'm also the advisor for the Wilkes County Recovery Friendly Workplace Initiative, and I'm the coordinator for Project How, Healing Our Workforce, which is all of the workforce development programming at Wilkes Recovery Revolution, including educational attainment, some of the training programs that Anna Maria was discussing that they offer in Nevada. We're offering like on-the-job training, credentialing, things like that, soft skills training like accountability and communication. So when we heard about what was going on statewide, first of all, Wilkes Recovery Revolution as an accredited recovery community organization has made a commitment to our community to bring free, confidential, non-clinical recovery support services to our community. So as we started looking at employment and workforce development as a function of recovery, that really started with our executive director, Devin Lyle, and programs manager, Jeff Walker, working with participants of a transitional housing program they had started. So it really started at the very beginning with what is the need of the people we're working with and how can we develop programming that supports them. So Wilkes Recovery Revolution started offering employment support, engaging with employers, and it became really evident early on that employers needed education and they needed support. And so the Recovery Friendly Workplace Initiative that we had heard about happening in other places became an interesting tool to explore. We spent about a year in research and development. So Anna Maria's colleague, Sam Steele, that she mentioned, actually met with me bi-weekly for consultative support during that year. We met with a community of practice that you can see the states represented on your screen here. There are now currently over 35 states, including Alberta, Canada, and then many other initiatives therein within each state that are working together, and more than just working together and sharing best practices and things like that. We're sharing things like survey tools to compile data on a national level, on a regional level. We're sharing things like legal precedent. So what does the Good Samaritan law look like in the workplace, et cetera. So looking at Wilkes County and figuring out what our needs were, we'd already been doing that for a while, and not needing to do it on a statewide level made it a lot easier. We had about 52 members on an advisory committee that was made up of peer support specialists. So people who have lived experience using substances, being employees who use substances, being searching for employment using substances. And then we had employers who shared their experiences on the other side of the table. We offer many different programs. We are able to get people transportation to work, harm reduction supplies. We have a work study program in the agricultural field called Fresh Start Farm. And that's just a few of the programs that we're offering. So we had done our resource mapping. We have 16 peer support specialists, so certified professionals with lived experience who help with resource navigation, getting people into treatment, et cetera. And so again, we started with this advisory committee where we really dug deep into the resource mapping. We looked at the structure from other states, and we decided what we would need in Wilkes County, North Carolina, which not 10 years ago was the county with the highest rate of deaths by overdose in the United States, and how we could flip that and turn our county into a recovery ecosystem that really supports individuals, supports families, and supports employers, because they are incurring a lot of the consequences, the negative effects of substance use. So we have toolkits that we referenced. SAMHSA has a toolkit. That's the Substance Abuse and Mental Health Services Administration, a United States Department of Health and Human Services branch. We have the National Safety Council toolkits, the Peer Recovery Center for Excellence. And so we knew there were tools out there. We knew that people were telling employers, you know, what it looks like to be a supportive employer, to have a workplace culture that supports wellness over substance use, et cetera. And so we wanted to create something that served specifically Wilkes County employers. So our toolkit, beyond sharing those that I just mentioned, includes letter of intent, sample language so that you can very easily engage with our initiative. It has pages that can be blown up and have been blown up for our employer partners into posters or copied and shared. And then we knew that we needed to have some data and some proof, because like a lot of you on this call right now, we had some employers who asked, okay, great, that worked in Nevada and New Hampshire and Rhode Island. What's to say this is going to work in Wilkes County? So we asked 5 employers to join us as early adopters. And we said, you're going to get some perks out of this, but please bear with us. We're still in the research and development stage. We want to see how this is going to work in Wilkes County. And it did. It worked immediately. We designated Tyson as one of our early adopters and got a call within a few weeks about an employee in crisis. We sent out a peer support specialist, got them connected with resources, and that employee is still employed at Tyson today. So again, we got our data, some data to share with other employers who may want to designate. We got some credibility around our initiative. And then from there, we started working with those 5 employers. We continued to learn. We joined the Northwest North Carolina cohort of recovery to work professionals, where we partnered with surrounding counties and we shared learning experiences. We reviewed materials. Surrey County specifically formulated a survey tool that we helped to edit and review. And in that way, we were able to get 138 responses from employers from the region on what recovery-friendly workplaces might look like to them, their knowledge base, and what kind of support they'd like moving forward, which in Wilkes County, that survey alone got 15 responses. In Surrey County alone, it got 50. So really, we expanded and compounded on our limited capacity within each county by working on this regionally. So, that's a little bit about how we got started and how, I hope that gives you some hope, especially some of the smaller communities who may be joining us today, that we can take these larger state-funded initiatives and make them work in a smaller community. Again, the first thing you need to do is make sure there are recovery resources for the people you're hoping to serve and connect with those resources. Then we recommend that advisory committee, perhaps a toolkit creation, whatever that advisory committee feels is the necessary component to engage employers in your area, those early adopters. And then now we are proud to say we have 11 fully designated workplaces. We have 5 working through the process of designation who will be designated in the weeks to come. And again, having them broken up, considering our capacity to serve, 5 and 5 again, and then we're into the next round, has really supported us in being able to offer something robust, an introductory or orientation type setting for these groups of employers. So we have, like I said, 11 workplaces designated. We've trained over 30 professionals in Wilkes County, from HR managers, directors, employees, career counselors, on what is recovery. Now, remember, this work is nonlinear. We're starting so far at the beginning in some cases, and we have resources that are funding things that are way far advanced, that we have to look at this in a way that's nonlinear, meaning some of the people that are in our workforce development programming connected with peer support specialists need less support because they've gotten the training they needed and they are well connected with a community than some of the people that are employed currently using substances or hoping to enter recovery or struggling to maintain their recovery, who aren't well connected, who don't access our resources for whatever reason. And so in those trainings, we talk about what is recovery, what are recovery support services, both in Wilkes and what we're missing. And then we say, so with all of these avenues for support and all of this, all these people fighting to get you connected with the support, why do we still have people that aren't accessing support? And we go into a review of stigma. So self-stigma, societal stigma, and institutional stigma, how they're informing each other and how language is informing that. And that way employers can see that this isn't a problem that starts with somebody using substances. This is a problem that starts well before then, and it takes an innovative approach with varied stakeholders to make an ecosystem or a community where recovery is possible, viable, welcomed, accepted. And so again, when you're considering a framework for bringing this into your community, there are some excellent frameworks in existence. SAMHSA is an excellent tool, and we frame a lot of our wellness education and information off of their 8 dimensions of wellness. It's a really good tool when you're helping employers to review their policy, if they can hold it against something and really consider what it's doing for their employee and what it's doing for the workplace in general. So that's one of the frameworks that we use in conversation with our employers. The second is this idea of prevention technology. So primary, secondary, and tertiary prevention technologies. And so primary being, we're not pulling people who we think may be at risk for using substances or addiction out of the workplace and training them specifically. We are giving wellness education about the risks of addiction to everybody in the workplace. That's primary prevention. We're also talking about just general wellness, because fatigue, stress, and overwhelm are forms of impairment. And so it's not just those using substances, it's those who are overwhelmed or exhausted, who aren't managing their wellness well, who are at risk for using substances. And then we have secondary, which would be you've incurred a workplace injury, you're about to go, use your workman's comp and see a doctor. Here is some information about addiction, the risks of addiction. You might get a prescription. Here is the resource in our community, Wilkes Recovery Revolution. You can get connected with somebody for some accountability and information. And then that person is just more supported during the process of using a prescription or recovering from a physical illness, right? We're all in recovery from something. That recovery process can be traumatic and difficult. And then tertiary is that direct support, where you might need to have a peer support specialist working with you on your accountability. You may need to get connected with some soft skills training just to get to the point where you can be the employee that your employer needs you to be. Again, all of these support retention. And so really quickly, I'm going to go through our process for engaging employers. Again, I want you to leave here today with this understanding that it is 100% possible to bring this work into your community if you're well connected with your resources, if you have supports for both employers and employees built into your program, and making sure that those support systems for employees are centering the people who use drugs or people who are in recovery, so that we're not losing out on providing services for them because we're funding services for employers. We don't like the idea of trickle down. It's good in one aspect, but we want to make sure that we're not losing the experience of those in recovery. And so we start off our engagement conversations with employers by defining recovery the same way that Ana Maria did. This SAMHSA definition describes an ideal employee: striving to reach your full potential, living a self-directed life, and improving your health and wellness. Who doesn't want that person employed with you? As Ana Maria mentioned, there are other excellent qualities of people in recovery that are consistent and that actually save money when people are accountable and they show up on time and they communicate their needs so that you can address it within the capacity or needs of your workplace. We do also share some of these statistics to, again, drive home the message that it's not your workplace, it's not the workplace down the street that's struggling with this. We're all affected by substance use in some way. As we move forward with bringing this work to North Carolina, we hope to get some more North Carolina specific data, but we share that the national economic impact of substance use is $442 billion, and we know that most of that is being incurred by employers. The National Safety Council has some excellent tools for employer engagement. This links directly to their substance abuse cost calculator, where you can break down your industry, the state you live in, how many employees you have, and really take a look at where your money's going when it comes to your expenses surrounding substance use. So you can compare, is a week of leave for this person to just get back on track really more cost effective than losing that employee? Or is a health and wellness training really going to save us that much money? And the answer is probably yes. And so this is a great tool just to show some of the hows and whys. I won't show these videos, but they are on our website. And as mentioned before, we will share our slides. But this details the gentleman in the gray sweatshirt is somebody who's in recovery, who has been given some power within the workplace to be the leader of the Helping Hands Committee. So a recovery advocate, a recovery ally, a peer support in the workplace. And that is so vital. We've had a number of our designated workplaces send people through the recovery coach certification program. And so now they have in their workplace somebody who is at least more competent on what recovery can look like, what the supports are that may be necessary, and how to get somebody to come up with solutions themselves that really work and fit with their needs. These are some pages out of our toolkit. Again, a lot of these are included on our website. We really do want to make sure that this is as simple of a process as possible for employers, understanding that the #1 goal of our initiative is to break down stigma. And that, again, nonlinear, it's a large undertaking, and we have to start where we're at with each person, with each employer. That takes relationship building, that takes trust. And so for the employer to come forward to their employee and say, oh, we're recovery friendly now, it's got to be more than a marketing campaign, a PR campaign. And so we engage with our designated workplaces regularly to make sure that they have key stakeholders informed about training opportunities. We have all of the employees that need to know about the services available to them informed. And so, we have the letter of intent as the first stage of engagement. We then do an orientation training that can be one-on-one or in a group setting, but it's going to give all of the how, what, where, when, and why of the initiative and what's available to them. And then we ask for a declaration to employees, which, if that's the first step you can take as an employer right now, is to let your employees know that you're working on it and that you're trying and that you're open to them coming forward in the workplace or expressing their needs for support. We think that's an excellent first step. We include resources in our toolkit specific to North Carolina, like the Reentry Initiative. We'll be adding soon some of the NC work specific resources, like on-the-job training and things that can really give you a leg up in working with diverse populations. And then this sample language is a huge part of our secondary trainings that we offer. We do a whole day spent on self-care, supporting others, and what it looks like to communicate concern as a coworker and as a supervisor. We think that language and the way that we deliver our messages of support are really, really valuable. And then we offer databases for resources, connection with other community members who may have resources, and opportunities to enhance health and wellness in the workplace. And I always add this slide because we would not be where we are today without the support of Nevada and New Hampshire and all those who have gone before us, and their dedication and our dedication to making this a collaborative effort. Recovery Friendly NC is our effort to say, we did this in Wilkes. It is possible to do it on a small community level, and we're here to support you across North Carolina in getting this done in your community, whether that be through helping you with a collective impact model or forming your advisory committee, defining your key components of your initiative. This work needs to be spread across North Carolina, and we don't really need to wait for the state to take it on. We can start today, and we can show them that it works. One of the things that's really neat is that the state-run initiatives, so Nevada obviously started in a recovery community organization, but New Hampshire started at the state level. They're housed now in the United Way, but they have 8 recovery-friendly workplace coordinators housed in a recovery community organization. So even the state-run initiatives are meeting us, in the middle where we gain traction. They're realizing that this is community work, that this takes small communities with even with limited capacity, deciding to take this on for us to make actual change. So I will break here. That was tons of information thrown at you all. Please feel free to unmute yourself, raise your hand, throw questions in the chat. And Ana Maria and I are pleased to stay here until 1. If it goes over 1, we're happy to stay and answer questions.
That's awesome. Thank you. If nobody has an immediate question, just use the virtual hand to raise your hand, or you can raise your hand on thing, and we'll get you in the queue there. I was just curious about like, I guess I was just surprised to see a dentist as one of the recovery friendly workplaces. Can you talk a little bit of how that came about? Because I think that's like that's pretty unique.
Absolutely. So the Wilkes Public Health Dental Clinic is our partner for our workforce development programming. So all of our students are eligible for $6,000 worth of dental care. And most, I mean, that seems like a lot, but it really covers barely, the work that's necessary for a lot of our students. It's the cost of having that cost was formulated because it's the cost of having all of your teeth removed and getting a full set of dentures. And so it does cover the needs of most, but not ideal for some. But so we're always looking for more dental care funding. And as we sent people over there, we kept getting requests for, can you send their peer support specialists? I don't think they understand their care plan, or this person hasn't asked any questions or really spoken up. I feel like they're uncomfortable. How do we better accommodate them? And so in working with them, we realized you're working towards becoming more recovery friendly. If one of your dentists came forward, you would know exactly where to send them, and you would definitely call me. And they're working on making that the case for their clients as well. So it was a natural fit. And that's something else we're really proud about, is the variety of workplaces that we have been able to designate, from workforce development agencies to dentists to fitness centers. Tyson was a huge one because they employ almost 5% of our population here in Wilkes. Great question. Everybody can be recovery friendly.
Hey, I'm John Fryer. I'm a person in recovery. I use he, him pronouns. I'm dialing in from Richmond, Virginia. And I really appreciate all the work that you all are doing. I'm on an advisory committee for Rams in Recovery, which is a collegiate recovery program. I work at VCU, which is Virginia Commonwealth University. And one thing I'm writing a proposal to do, basically recovery friendly workplace environment here at the university, which employs 20,000 people. So what you talked about is really fantastic. And I've seen some resources from New Hampshire and from Massachusetts as well. I'd be really interested in any materials you have around the restaurant industry. I'm a part of this group called Ben's Friends, which is a support group for people in the food and beverage industry, which is where I formerly came from before coming to the university. And we're specifically trying to do some training for restaurants so that they can be recovery ready. So any materials you have, I'd really greatly appreciate, even one sheets or posters. I know that Anna Maria talked about things that can be blown up in the workforce. So
definitely, I would connect you with Anna Maria to talk about their training program. And then another place that comes to mind is Colorado. There's a program called CHOW, and they are specifically about recovery friendly workplaces in the hospitality setting. We all know hospitality settings have taken a big hit per COVID. And one of the neat things about recovery friendly NC and spreading this across the state or a region is that I imagine we're going to get very hyper focused on recovery friendly campuses, recovery friendly churches, recovery friendly doctors' offices, and what that looks like. And that's why it's so important that we collaborate and share this kind of information.
Yeah, and John, I'd be happy to share with you some of the information that we have that is hospitality specific, because we do have a ton of it, being one like our major industry here in the state of Nevada. And I was actually also about to mention Chow because they do such a good job at supporting people in the industry.
very helpful. Thanks so much.
I did drop the Chow website in the chat for you, John, there as a resource, and I'm glad that the recovery friendly NC like just kept it limited to that. Like, so it's like, because there are like recovery friendly congregations that are popping up. I know Alabama's doing some stuff. I know that Ohio has done a lot around recovery friendly congregations, and so there are like these other sort of like toolkits that you can find out there that, and I like what Ariana had talked about with, it's just like making sure that this can be a community driven thing, but have it not just be like in name only, right? Like to be a recovery community workplace, I mean, a recovery friendly workplace or recovery friendly congregation, it's like there has to be training and something involved and ongoing support. And so not just to like, hey, look at us, we're doing, we're supporting people. It's like, let's make that a very real recovery support for people, because people go to their churches for help. People might go to their employers for help if they see that there's that they're intentional about it and promoting it, and so I just wanted to put that out there as like just some good resources in the chat box now, if you want to follow up there.
Awesome. Thank you, Aaron. Any other questions, comments, or concerns? So I will say what's next for Recovery Friendly NC is that at the end of this month, our advisory committee is going to be formed and start meeting. And that will look like reviewing, again, this is the same kind of model we use for our community-based initiative, where we will form a committee, look at key components, even breaking it down into churches, campuses, et cetera, and then invite the public to join us for our meetings. Yes, Donald.
Yes. I really dig the data, the financial benefit data of responding sanely and appropriately to substance use issues in the workplace. But when we go into the benefits of hiring people in recovery, I wish we had a body of data for that. I have some concerns about our using maybe some romanticizing stereotypes sometimes about we're all really hardworking and we're all really grateful, because that can be stigmatizing too. And I know it is difficult data to collect. So I would just caution about navigating that, what is the benefit of hiring us? And then there's the whole recovery principles thing, because there's an assumption there that we're all coming from maybe the same subculture of recovery that has a body of principles, and we don't. So if I've been looking for that and I can't really find that yet, maybe we call out less or than normal folk or whatever. I don't know if that exists or not.
So Donald, that's an excellent question. And it does exist, kind of. So the National Safety Council puts together, that substance use cost calculator, and that's what it's breaking down. It says, people in recovery miss 13.7 less days per work than those in active use, and, almost 7 for those who aren't using substances. And one of the most important things that I want to do with Recovery Friendly NC is decide what our priority outcomes are, what our objectives are, what are we measuring, because retention is harmful. If we measure retention, how many of the recovery support professionals on this call have gotten the call that I cannot be here, this is not the place for my recovery, and you pull them out before you've even finished their resignation letter, right? So can we really be judging retention, and is that more or less harmful? But I love the idea of the characteristics of recovery, and yes, it can be stigmatizing to lump everybody together, but that hope of at least well-connected, at least, there's people out there that want to see them do well, from sponsors, which may be one structure or pathway of recovery, to peer support specialists, to, if you designate a recovery coach in your workplace, somebody with lived experience, preferably, there's that connection right there in the workplace where they don't have to go to HR, they don't have to go to treatment, they get on the dot support in the moment.
I dig it. There's got to be some language about people in recovery tend to have a more deliberate support structure in place. And nice. Thanks. Appreciate that.
Ariana, is there a county that has shown, outside of the one that you're in, that's shown that initial sort of interest of hey, we want to do that? Is there a way that people can support and encourage that? Okay, we have one county, right? And this is what it looks like. So what is that next county that has the resources and the drive, and where can we organize to make that happen, to get that get that second location of, you know, like, and so I'm just curious if you have that, if that's kind of come up.
A ton have come forward through that. Northwest North Carolina Recovery Support Learning Cohort, or the longest title ever that I've been working with. This is a Development District Association of the Appalachians program. I partnered with Surrey County, who has begun hiring. They have, I think I saw Sonia on the call, they have somebody in recovery working for a county office, supporting people, supporting employers, collecting resources, which is excellent. Watauga County has worked with us as well on that and is getting ready to get started. Of course, Buncombe County. Now, Buncombe County is going to be interesting because that's going to be one of the first larger cities, and there may be a need for more than one, unique resource. But Sunrise Community for Recovery and Wellness is well positioned to just get started. They've got the support for employees, and then they can't, they have relationships with employers. Philip Cooper is all about moving this forward. Asheville is an excellent example of a recovery ready community, of a recovery ecosystem that is in existence. In fact, we send people to Asheville, which is a skewed method in and of itself, and we're working to build more support in Wilkes. But there's definitely, and that's just Western North Carolina. That's why I got so excited, Aaron, that you're in Eastern North Carolina, because I was like, there's our stretch across the state there. And, it really takes a unique group of stakeholders to look at this, because recovery support professionals maybe can't solve all transportation issues. We need cities and towns to be engaged in that. Housing, we need the federal government to come and fix the housing issue here. You know what I mean? So it's going to take a bunch of unique stakeholders. And so to get started, first of all, email me, go to our website. There's a form to submit to say that you're interested. Start gathering your advisory committee, start looking at resources. If your county isn't ready, maybe your region is, and start collaborating across people. If you're in a larger city, break out into sections and make sure that each area, because transportation and housing are a barrier, is well supported. Kit? Oh, hang on, you're still muted.
Okay. I pressed unmute, but it didn't quite work. In talking about recovery, I'm assuming that it's abstinence, correct?
No.
It's
No.
not considered abstinence. Okay. Yeah, because a place in Asheville just opened up that is a treatment center, and they are not, it's not abstinence. It's about refiguring how your brain works so that you can actually drink again. And so I'm like, oh, wow, that just kind of goes against what I learned in recovery, which was, I wasn't ever going to drink again.
Yeah, and that is, we need your voices. We need people who are abstinence-based to speak up so that other people can understand that is possible and that that's a pathway. But, for instance, our executive director says recovery is any positive change. And as far as, and what I'm informing our workplaces on is that if your employees come to work and are productive and are improving their health and wellness and are living a self-directed life, meeting your needs, it's none of your business what they're doing outside of the workplace. And if that person needs MAT, if they use cannabis when they go home, it doesn't really matter as long as they are healthy and well. One other thing that we advise our employers to do is to check in regularly from the start, so that the first time you pull someone in your office isn't like, I smell cannabis on you. It can be, hey, this is another check-in. How are you doing? I haven't noticed any work-based changes, but I wanted to check in and make sure you're okay. And if that person was trying to live a life of abstinence, they may say, I need to go home today and just figure some stuff out. But definitely lifting up every pathway to recovery is 100% at the bottom of the foundation of this work. I'm putting my email in the chat and also the Recovery Friendly NC website. And so you can fill out the form on there. It'll come directly to me. We're looking for members of our advisory council, if you're advisory committee, if you're interested. Otherwise, I'm happy to meet with you and get some stuff moving and started. Yes, Michael.
Michael.
Yeah, I was just going to ask too, and for like, I don't even know how abstinence is really a thing. I don't think employers understand what you mean. Like, because if you go smoke cigarettes, are you abstinent? Like, but I would ask, so people with substance use disorders, and you probably know the answer to this, we're protected under the Americans Disability Act. So you can't really ask me about my past substance use, or like, I mean, there's a lot of laws protecting people with substance use disorders as far as like asking questions. I mean, if I work for you, you can ask me to take a drug screen, but you can't ask me a lot of questions about my past and history with substance use. Is that correct?
That's my understanding in terms of a legal perspective. From a decent person perspective, I really believe, and I don't mean to offend any employers on here who may have used that pathway in the past, but in terms of, maybe I should say, trauma-informed practice, not asking specific questions about trauma or making assumptions. One perfect example of that is somebody came into the workplace regularly late, they looked fatigued, their hygiene had gone under, and they pulled them in, the director pulled them in their office and said, I know you're using drugs. I know that, how can you do this to us when we've given you this chance? And it turns out this person had undiagnosed diabetes and had never used substances. And so that's traumatic. That's an awful experience to put them through. And now they're probably in recovery from that mental health experience that could have been avoided with just a general, hey, how are you? We've noticed work-based changes. Yes, Elisa.
Hi, I'm Elisa with Sunrise Community for Recovery and Wellness. And I wanted to kind of go back to what Kit was saying. I think that I had heard about that treatment facility that was opening, but I think that they use naltrexone. I think that it's a harm reduction model treatment facility. I just wanted to double back on that because I do think that they are harm reduction. It's where the medication that they're taking blocks the alcohol, the effects of the alcohol. And I've really enjoyed this today. So much good information. Thank you.
Yeah, that's called the Sinclair Method. If you want to look it up, when you use Vivitrol or naltrexone to drink in moderation or to stop drinking. It's really interesting. There's a TED Talk on the Sinclair Method.
And it's a good thing for employers to become educated on, because there could be an employee who's abstinent from IV drug use, but they see them out at TGIF, whatever, Fridays, and they're drinking wine and they're like, oh my gosh, there goes my employee. And that's not the case. So it's really important that employers are brought up to speed on what's happening to keep people well. And I will say employers are really open to this. It's not something where they're very silent during the training. Jeff Walker, my programs manager, who's on this call, and I did a training with almost 20 people from our designated workplaces. And at the end of day one, they requested that we extend day two and that we bring harm reduction materials. They wanted to see naloxone. They wanted to see fentanyl test strips. They wanted to understand how they were used. If they were allowed, if maybe their workplace said, don't bring Narcan naloxone with you, we don't want to have it in our workplace, that they are allowed to have it on their person and things like that. And then they asked us for quarterly training. So, they're very receptive to this. They are totally aware of the consequences of not addressing this as an issue in a lot of cases, and they're wanting to become a part of the solution. Yes, education on opioid use, medications for opioid use disorder as well. One of our designated workplaces is our local MAT clinic. MAT stands for Medication Assisted Treatment, and it is the absolute gold standard for MOUD and making sure that people are getting the help they need to live well. Trying to look at the chat here. Anna Maria, can you think of anything that specific to engaging employers or working with employers? Because I think that can be one of the biggest hurdles for people, is like, how am I going to go to employers and have them see me as a credible source for this information?
Yeah, I think that leading with definitely like the statistics, right, and how substance use impacts the workplace is really important, but also like backing it up with their lived experience, right? Like make those numbers come to life and be that example. We talk a lot about what life as an employee used to be like before recovery and what it is like now. And those are the stories that really make it come alive for an employer who may be thinking about that one employee that is exhibiting all of these same signs that we're talking about right now, right? And they're also thinking about that one great employee that comes to work every day, and they're thinking about like, how can we help people that are struggling, give them a little bit of better resources and tools to help them thrive, in whatever way that means for them. So I think that lived experience is a really important part of this process of just being open and vulnerable about your story of what it was like to be an employee that struggled, and what it's like being an employee that doesn't, right? And what was that bridge and like those systems that came into place to allow you to go from one to the other. I think that usually has the most amount of impact.
Definitely.
Thank you, everybody. We are at the hour here, and we are going to put this in a Google Classroom and get it out to other communities across the state that are interested in recovery-friendly initiatives. And then, in here specifically in North Carolina, really just focusing on, hey, what is that next county? How can we be helpful to help build that out? And I want to thank both Ariana and Anna Maria for coming in today. And this is the first of a couple different series that we're going to try to keep this at the forefront. This is very good in terms of giving people the 101 of all of this. And so I think part of this is like, let's work to make this a reality and work to drive this in our communities. And so most we can say is stay tuned, and we appreciate you all for taking some time out today for jumping on the Zoom call. So thank you, everybody. Appreciate it. Bye, everyone. Be safe.